Hello, I'm Miguel. I'm going to be your nurse today. I'm going to be giving you an ears, nose, and throat assessment. Okay? Okay, so first I'm going to start with inspecting of the ear. Okay, so I'm looking at the ear while also palpating. Let me know if anything hurts.
Nothing hurts.
Okay. Okay, I'm noting the size and positioning of the ear looks normal. The auricle as well as the tragus are non-tender. There's no lesions. No mass is palpable. No pain noted on retraction or palpation. Okay, and then I'm also looking at the canal of the ear. I would be looking with an otoscope, looking for any discharge, masses, or bleeding in the ear canal, or lesions. I don't note any. And then I'm also looking at the tympanic membrane, which is it's flat, no bulging or retraction noted. It's pearly gray. No cerumen noted. And while doing this, you would, while looking at the otoscope, you would be retracting the ear up and back, as this is an adult patient. And then you would be looking simultaneously at the other side. Okay. You'd be looking at the other side for the same things. The patient's ear looks normal. No tenderness, redness, or swelling or mass is noted. No perforations in any part of the external ear or the ear canal or the tympanic membrane are noted. Okay. And then after visual inspection and palpation, you would do a functional assessment. So for this, we would be doing a whisper test. So I'm going to be standing 2 feet behind the patient and whispering a 2-syllable word while the patient occludes one ear by pressing the tragus of his ear into the canal. Okay. Okay.
Apple.
Okay. Good. And then for the other ear, use a different 2-syllable word.
Palm tree.
Very good. Okay. So no notable hearing deficits are noted. Ears look good. Okay, so now we're going to proceed with the nasal inspection. So, okay. Normally I would be doing this with a nasal speculum, looking at the turbinates, looking for any polyps or masses, lesions, or bleeding. I don't note any. The membrane looks good. No redness or swelling are noted. The nose is symmetrical. No obvious lesions or deformities are noted. Okay. I'm going to be palpating the nose. Let me know if anything hurts. Anything?
No.
Good. Okay. Nose is non-tender, no pain. The septum is also non-deviated in midline, which is a normal finding. No perforations in the septum as well. No rhinitis, no rhinorrhea. Okay, and then after inspecting the internal nose as well as the external, and palpating the nose, I will be palpating the paranasal sinuses. So starting with the maxillary sinuses. Let me know if anything hurts. Okay, and then next, the frontal sinuses. Okay, all right, no pain?
No.
Okay, so the sinuses of the patient are normal. There's no inflammation or tenderness noted. Okay, and then next I will be doing an oral assessment of the patient. So, okay, I wash my hands. Okay. All right. I don't have a depression stick, but I have a purple tab, so I'm inspecting the gum lines of the patient as well as the buccal membranes. Okay. Okay. The gum line of the patient looks good. Buccal membrane looks good. The lips also look good. There's no dryness, crackling, or fissuring of the lips. Okay. And then with my pen light, I would be illuminating the upper, the more internal structures of the mouth. So I would be looking at, I'm looking at the palate of the mouth. Okay. Palate of the mouth looks good. There's no breaks in the palate. No lesions or discoloration noted in the palate or the membranes or the gums of the mouth. Okay, and then I'm going to be depressing the tongue and then looking at the uvula. Can you say ah?
Oh.
Okay, good. So the uvula of the patient rises midline with phonation, indicating a proper function of cranial nerve 9 and 10. Okay, and then can I have you move your tongue left and right? Good, and then in and out. Good, up and down. Very good. Patient has free range of motion of the tongue, indicating intact cranial nerve 12. All right, and then finally, I'm also going to be looking at the sublingual. Okay. Okay, good. So sublingual of the patient looks good. There's no inflammation noted, no inflammation or lesions noted. And then the tonsils of the patient were noted to be removed earlier in the history of the patient, history taking of the patient. So no grading of that is needed. The esophagus of the patient also looks good. There was no abnormal secretions or sputum, no bleeding or lesions noted in the back of the throat. Okay. I'm also, after the inspection, I'm also going to be doing a palpation. So I'm going to be doing a bimanual palpation. Okay. Let me know if anything hurts. Okay. Okay. All right. And then, oh, sorry. Can you open your mouth again? And then your tongue. Sorry, up. There you go. Good. All right. I don't notice any lesions in the mouth. No lesions, no lumps or swelling or masses in the mouth. Stenson and Warren's gland look good. There's no redness or tenderness. No inflammation of the glands, which is normal. So that completes our ears, nose, and throat assessment. So yeah.